is Tuesday, July 25th. It is 10 o'clock, and this is the Wisconsin Caregiver Support Community Statewide webinar. Thank you so much for joining us today. If you aren't talking, if you'd be so kind as just to make sure that you're muted throughout the meeting today so we don't have any background noise and we can hear the presenters. Once again, it's a pretty packed agenda. We are recording for the purposes of posting it on the website and others being able to view it afterward. I will do a quick overview and I will share my screen of today's agenda so we all know what's in front of us, as well as the recording and the notes and any pertinent documents. Those will all be posted in the same place. I will actually take a minute here, share my screen, and bring you right to where they're posted on our technical assistance page. Oh, right here. So if you go to GWAR, you go to technical assistance, you click on the family caregiver support tab, scroll down, and you will see the Wisconsin Caregiver Support Call monthly calls. We have our agenda here under July, and just posted hot off the presses. We actually have our August meeting set up pretty early just because I know there was a lot of question as to what was going to be discussed and maybe excitement around brainstorming. So that is also there for your review. Today's agenda is including overviews of advocacy efforts and really the summary of Janet put together a wonderful summary of the joint finance and the outcome. So she was unable to join us today, so I will be sure to go through very quickly the outcomes, but give you some idea of what to expect today. And Word is taking its time, so we'll use this one. After the updates, we have Lynn Gall from DHS so that she can provide some really important and exciting updates too about some projects and some proposed updates to the Older Americans Act. We then have Kristen Litzelman joining us. She is an associate professor with UW-Madison Extension, and she's going to be asking all of you to help her come up with some pre-caregiving content and how to pull those pieces that exist in their world and kind of wrap it up in a nice bow so that we can share it out to our family caregivers. And then last but not least, we have two guests joining us today. We have Angela Sullivan. She is our health promotions and evidence-based program specialist. And then we have Nick, our transportation specialist. Both are going to share a bit about what they do, what they can offer, how they can be a support, but also focusing too on how those resources, that funding and those programs can come together to help support the family caregivers that you all work with every day. So I am going to actually not stop sharing my screen. I am just going to move on over to Janet's budget comparison and summary. So there are quite a few topics that the Wisconsin Aging Advocacy Network requested joint finance to review. We also had sent information and communications with the governor, as well as joint finance, as well as having an aging advocacy day to highlight a lot of this work. If you work in the world of adult protective services, I will again save this to our notes section on our technical assistance part of the page. So please come back and devour all this wonderful detail. But I am going to cruise over it right now just for the sake of time. If you work in an ADRC, which I know many of you do, you might also find this information helpful about what was ultimately decided as part of the budget and what we asked for, but was not included. And then for our purposes of today, I'll talk a little bit about, well, it's not quite yet, sorry. There's also the Alzheimer's and dementia support. So this is really the DCS budget, dementia care specialist, and some of the funding that was asked for their work. Some of that does include AFCSP, so the Alzheimer's and Family Caregiver Support Program. This information is also captured down here, so I'll review it when we get to the family caregiver section. Also, Board on Aging and Long-Term Care. So these are ombudsman's positions and budget. You can review the asks and what we proposed and then what the outcome was. And here is the stuff that is really pertinent to our family caregiver support community webinar. We did ask for support with the Wisconsin Family Caregiver Tax Credit. This was not included. We did ask for additional funding in respite care for the Lifetime Respite Grant, which is actually something Lynn is the program manager for. That too was not included. We asked for consideration on the expansion of the Wisconsin Family and Medical Leave Policy, also not included. There's some detail there too about some conversation and work with the governor's office. We did, however, oh, I may have cruised by it. Sorry, I may have to go back up to the Alzheimer's and dementia support. We did, however, from Joint Finance get an annual increase amount in our AFCSP program. It provides $3 million annually, and it increases the max that DHS is able to offer. I'm not entirely sure what that means. I think there was probably an opportunity for DHS to, if there was, excess in budget, to share some of that within the AFCSP program, but up to a certain limit. Now that limit has a cap that's been removed. I don't know in practice how helpful that is or not, because typically budgets are tight and lean, especially as we go into the next few months and the next couple of years without the additional funding we've been used to. However, that was what was included. There was some question, I know, in emails I received about whether or not the income limit had been raised from the 48,000 eligibility requirement to the proposed 60 that we had asked for. That did not happen. So there is still the income requirement going forward of $48,000 for AFCSP. I know Lynn too also had mentioned vocalizing some of the issues you guys have had with AFCSP, that the cap of $4,000 has really limited some of the offers that you can give to family caregivers. So that too was something we were looking to have removed. And as it stands right now, the cap is still 4,000. So that's a quick overview. There is so much more here. She spent a great deal of time. This is such an amazing tool to just have a detailed but both quick at a glance opportunity to see the outcome of the state budget and how it affects your work and possibly your family, your life that you live on a daily basis. So please take the opportunity to review all of this information. If there are any questions, you can certainly reach out to me, but also Janet would likely be somebody I'd have to pull on if it's regarding this information. I will take a breath and I will stop sharing my screen. And for the moment, I am going to turn it over to Lynn Gall for DHS updates. And then following her, we will hear from Kristen.
Okay, thank you, Bryn. And good morning, everyone. This is Lynn Gall, DHS. And a couple things I just wanted to mention to you this morning is, first of all, those of you, some of the counties have got the Independent Living Supports pilot launching very soon. I think some have started a soft launch yesterday if they felt ready, but an actual launch for everybody hasn't quite happened yet. So I provided Bryn with a link, which she is going to post and maybe put in the chat, where you can look just to double check to see if you are one of the pilot sites. If you are, I want to encourage you to make sure, if you haven't already done so, to make a connection with that person who is in charge of the Independent Living Supports pilot in your county, because that program is really going to be working hand in hand with ours, I think, through the course of the pilot. And then especially not only during the course of the pilot, but at the end of it, when people transfer off of it, because it's funded by ARPA, it's only a year and a half pilot. And so when it ends, unless, our hope is that we can get another program in place to continue on and get funding to do that. But if not, some of those people who are participating may be looking to reconsider their options. That might end up going into long-term care. It might end up being coming to one of our programs. So having that connection as the pilot's going on is really important. If you're not familiar with ILSP, excuse me, basically what it is, it's very, very similar to our family caregiver support programs, only instead of enrolling the caregiver, you're enrolling the care recipient. And it's for people who have at least one need, functional need, and they're at 300% or less of the federal poverty level. And so these are people who we kind of think are maybe pre-Medicaid. They might eventually need a long-term care program, but we're not sure. So the goal of the pilot is to see if we provide these supports earlier, will we, extend the amount of time they're able to live at home or not be on a long-term care program. So that's what's happening with that. And they get $7,200 a year, each participant, to spend on their in-home services or home modifications or a lot of the same things that we do with our programs, and caregiver supports and respite and, all of those sorts of things. They put together a plan, a service plan, similar to the way we put up together a service plan for our folks. And so working hand in hand with them, I think is going to be really important to understand what they're doing. And then when the transition comes, to see which program they go through options counseling for what program it makes sense for them to transfer over to at the end. So please take a look at that press release that we put out about the program. There's also information on the SharePoint site, as well as our DHS website that you can look at for more information. The second thing I wanted to talk about is the Older Americans Act regulations updates. We talked about this at the last GWAR ACE meeting a little bit, but Older Americans Act, they're looking to update these regulations that haven't been done since the 1980s. It was the late 80s, and the National Family Caregiver Support Program wasn't even in the regulations. It wasn't even created till the year 2000, so we weren't even in there. So they're adding us along with updating all the other regulations, everything that has changed in the last 30 years or more. And we have an opportunity until August 15th to make comments about what we think about the changes to the regulation and just how they're weaving our program in there. So I know a lot of the directors are looking, have already started looking at that. You may have already started looking at that, but I urge you to take a look. There's also a link that Bryn will be supplying, or I think if you click on the agenda, there's a link that'll take you right to the page there. Like I said, you have until it's noon Eastern time on August 15th to submit those comments. So take a look. We at DHS were putting together our own submission, and then I believe that some of the associations are putting together, like WAN and other groups are putting together comments that they'll be submitting, and you're welcome to do them by yourself or as your agency. You can submit comments as well. One of the things that came up, and I know Leslie has brought this up to me this morning, is that there's a mention in there about not allowing any means tested state or local funding to be used as match for NFCS, for any of the Older Americans Act programs. And for us, that brings to mind, a lot of us are using, if maybe not all of us, are pretty much using AFCSP as a match for Title IIIE. And so that's going to be a problem. So that's one thing that jumps out really strongly. And I think we're working up a good argument against why that should not be, because I think that will put us all in kind of a bad spot if we had to come up with different local funding to use as a match instead of the Alzheimer's Family Caregiver Support Program. And hopefully we'll have enough leverage and enough voice to say we're serving the same people. It's state funding, and it's not, even though it is somewhat means tested in that they have an income limit, it is serving the same people. And I think we can make a pretty good argument that it serves those most in need, which is another one of their requirements, those most socially and economically in need, which is what that program does. So hopefully we can make a good argument for that. But if you have any thoughts or ideas you'd like to share with me about comments along that, please let me know. There's nothing else in there that really jumped out to me too much. I have time marked off tomorrow to really sit down and go through it. So I'm open to anything you have to share with me about that. And the third thing I just wanted to mention is that on Thursday, I'm going to be sworn in to the National Raise Family Caregivers Advisory Council at the federal level for ACL. This is the group that created the national strategy, and now the second group, they're appointing some new people, and our job is going to be to implement that strategy. And I don't know really what to expect. All I know is I'm being sworn in. They got a little bit of an idea of what we'll be doing, but that will happen on Thursday, and it's televised. It's on the web if you would like to watch those meetings. They are always available to you to watch. And I hope that I just want to share, it's kind of what I said at the board meeting, is I hope that my being on there will give Wisconsin a voice. And I hope you all use me as a voice to give me your thoughts so that I can share those and make sure that they're hearing from us. I don't look at this as just my appointment. This is all of you guys having a voice too. So I think that's all I've got for you today. Thanks.
Thank you. That's actually quite a bit. Yes, congratulations are coming through in the chat, Lynn, on your appointment, and really a thank you. Thank you for carrying the torch and bringing our voices from a state to a federal level and representing us. That's quite an honor. And now we will hear from Kristen. So we've gone back and forth and had a bit of discussion. I am not going to do justice to really nutshell what it is she's looking for, but I knew that you were the audience that she needed to connect with. So I will turn the mic over to Kristen so she can explain a bit, and then feel free to take yourself off mute and throw information in the chat, and I'll be collecting that for Kristen.
Yeah. Thank you, Bryn. And my student Ashley is on the call too, so she can share slides. I like having context. Visual aids are always helpful. So Ashley Berghoff, if we need to give her sharing permissions, and then she's going to share the slides. While she's doing that, I'll just start and sort of tell you why I'm here and what we're trying to do. Oh, there, look, slides. Excellent. Okay. So Ashley, you can actually skip right to the next slide here. So I come to this wearing a lot of hats. I know Bryn and Lynn and possibly others on the call through the Wisconsin Family and Caregiver Support Alliance. And so that's why I knew that Bryn was the one I needed to go to get the audience that I want for this sort of brainstorming session. But I wear other hats too. I'm a researcher on family caregiving. I do a lot of work thinking about the way that context and resources are accessible for caregivers. I also work with UW Extension on providing support programs that help families. And that ranges from things like end-of-life planning to aging mastery programs. I help the educators in the states to understand how we can connect the research literature to the work that they do to make sure they're giving good information to the families that they work with. So we're going to try something today. We're going to try to use something called Slido to access information. So I actually want to start with a little piece about what you already know about extension, because I know on my end that some of the educators I work with collaborate very closely with their local aging units, but I'm not sure that every aging unit knows their extension educator very well. So here's what we're going to do. Ashley put a link in the chat that you can follow. And then she's put the code in the chat as well. So we're trying this to just see how well this works. And then if it works well, we're going to help collect information this way. So click the link, add the code, and then just tell us between 1 through 5 how familiar you are with extension. And we'll just see if this works. I'm seeing lots of 4s. Okay. Oh, some 5s, some 3s. Okay. Great. Keep going. And Ashley, on your end, I don't know if it tells you how many responses we've got, but when we kind of start seeing it slow down is when I think we'll move on. Okay, this is great. Okay, so I'm seeing
up in the right-hand corner, it has the participant numbers.
Thank you, Ashley. Okay, and I think we can probably just pause here because I'm sort of seeing that we're ending up kind of in the middle, where people are familiar with extension, but maybe not working super closely with extension, which is kind of what I would expect. We're going to pause there just for time. So Ashley, go on to the next slide here. Okay, so just to give you the overview, extension is, I tend to talk about it as kind of the outreach arm of the university system. And the goal is to take the information that we know in all the ways that we know it and connect it with the people all across the state. So the idea is to help people thrive by connecting them with evidence-based information. And we have educators all across the state who do everything from agricultural work and helping farmers do the best farming job that they can and deal with things that come up in terms of pests and how to take care of their animals and their crops, all the way through to parenting, which is really common, and also things like aging programming and how we help families to thrive as they're aging across the state. So Ashley, flip on to the next slide here. So we do wear a lot of hats in extension. We kind of act as knowledge brokers. We convene partners together. We do a lot of direct education where we're teaching families about specific topics that we've seen they need information in. But we also work in policy systems environment where we are educating employers or community leaders or trying to change the systems around the families in order to make sure that they have the context that they need in order to thrive. So there's a huge array of things that we're doing. And Ashley, next slide here. A couple examples that I'm sort of pulling on as I'm thinking about this next step, which I'll get to in a minute. We have a program called Planning Ahead, which is financial planning for the end of life. It's essentially seeing that there are situations where people lose a family member and they have no idea what to do with the finances. And if we can prevent that, if we can get them talking about that earlier, it helps. So that's a program that we have been launching for the past couple of years. We also have the Wise Wisconsin Learning Series, and some of you may offer powerful tools and may collaborate with extension educators on that because some of my extension educators also do that. Michelle, I see your comment about Red Cliff not being listed. That's a good question. I don't know the answer to that because I did not create that map, but I will write that down and check it out. Thank you. Okay, Ashley, next slide here. Okay, so here's what I'm seeing in this space and what the real conversation is about here. We know that there's something like 15% of Wisconsinites who expect that they're going to become caregivers in the next couple of years. We also know that people who are already in what we would call a caregiving role that don't think of themselves as caregivers. And so they maybe aren't accessing resources and they maybe aren't taking the steps that would be helpful for them. And so with that in mind, I'm thinking about whether there's a space to approach people who know they will be caregivers or maybe are early in caregiving and aren't thinking of themselves yet that way, but see that they have a need to help them set the stage for when a health crisis does hit so that they're ready for it, so that they have that fertile soil where they can build resilience. So Ashley, next slide. And this also connects through with my sort of research background because there's a ton of research in caregiving. And I've recently learned that there are lots of people who don't know that there's a ton of research in caregiving. It's a ton. We have a lot of information about it, but a lot of it is kind of stuck in the sort of ivory tower research space and isn't necessarily translated into something that families can put their hands on and hold and use. So Ashley, flip again here. So I'm thinking about this as a space where we maybe have an opportunity to help people set the stage before they're caregivers and prevent some of the chaos that happens when there's a health crisis by taking the information that we know in the evidence base and mobilizing it for them. So generating awareness about the impact of caregiving and resources that are available, about imparting knowledge about how they can keep resilience, about how they can access resources, about how they can prepare, inform the way that caregivers act as practitioners in their own lives, helping their care recipient. So here's the real question. All of that sets the stage for this question. Based on your experience with these populations, what do you think people most need to know or do before they become caregivers so that they can be well prepared? And I want to have a conversation in this space just to start planting the seeds and start generating topics that we can maybe think about implementing and trying on for size to see if we have an audience for this, to see if it's helpful for people, and to see if it's something that makes it easier for people to access resources or to hit the ground running when they do suddenly have a health crisis they need to deal with. So go back to that Slido. Ashley, if you could put the link in the chat again, just to make sure people can get it. Go ahead and put your information in there. You can also put it in the chat, or you can just unmute and say it out loud, because I want this to be sort of a discussion around what we can do ahead of time if there's a space for that. And I'm just reading these, and I'm not reading them out loud because I know everyone will get overwhelmed if I'm talking and we're writing at the same time. This is great. I'm loving this right now. Yeah, so I'm seeing a lot here about information and resources. That is a space where my brain is going a lot too, because I think one of the problems is that even if people know their caregivers, which they often don't, they don't know their caregivers. And then once they do realize they're caregivers, they don't know there's resources available, or they don't know how to access them, or they just don't even think about it. One of the surveys that we did through the Wisconsin Family and Caregiver Support Alliance, we asked caregivers about their way they access resources. And most of the resources they were accessing were for their care recipient, which makes sense. But then we asked them if they ever asked for resources for themselves when they were on the phone with these organizations. And the answer most of the time was no. They didn't even think about asking for support for themselves. And it's a little messy because the support for the care recipient is often also working as support for the caregiver. But they may not even realize that these things are out there and that they have access to them. And so that's certainly something that is coming up a lot. I'm seeing the one about people who become acute caregivers. I would love to hear more about what that means, what the thought process is there. Because when I hear acute caregivers, I'm thinking like something really, there's a real health crisis that happens that's very momentary, that like happens very quickly, and you're sort of all of a sudden dropped into the caregiving role, as opposed to like the slow slide, which we sometimes see. But I would love to hear a little more about if that's also the way it's meant, or if there's other things that feel important in that acute caregiving piece.
Hey, Kristen, I wrote that. Yep, you're exactly right. So a scenario of maybe somebody being in a car accident, and then the next day, the husband or wife are now the acute caregiver for life. So how to access resources when you may not be in the right mind to do so. So maybe connecting with healthcare and getting help that way.
Yep, great. Okay. And I'm mostly, so that I can't see all of the comments on the screen at the same time, but so I'm sort of focusing on this one on the bottom. For me, who is their support system? I think that's so important, because I think we often don't recognize sort of how far those roots go or where we can turn for help until the crisis happens. And if we can sort of think about that ahead of time, we can maybe pre-plan how we're going to allocate care, so that it's not such a crisis decision. It's a little bit more comfortable and thoughtful. Yeah, so I see this comment. Terry, thank you for your comment in the chat here. Yeah, so this is something we see a lot, right? Is that people are interested in supports, and then when the rubber hits the road, it's time constraints, it's mental energy, it is all kinds of different pieces that make it hard to access those things. So what we're trying to think about is how we can do this in sort of a multimedia way, right? So it wouldn't just be one thing that is offered real time. It would be something that's offered real time, but could also be sort of snapshotted by extension educators or by you all in the programming that you do. It could be something that they could access on the website. It could be videos. It could be paper copies of things. Kind of thinking about the way that we can make it both a push and a pull. Yeah, and they often wait until the crisis. I mean, that's so true. And that's what, but we also know that when we ask people, are you going to become a caregiver? There's so many that say yes. So they know. And I think I think there's some space there. And that's one of the things we're trying to figure out. I have no idea if this will land or not. It's just kind of a brainstorm to see what ideas do we want to prioritize for starting, and then give it a try and see if it lands or not. And, maybe it doesn't land, and then we'll maybe try something else. But if we can build that, wouldn't it be beautiful if we could help people prevent some of the burnout beforehand? Yeah. And one of the things that I've seen is that when we search for information about caregiving, I think this is true for a lot of other things too. We get a lot of listicles where it's like this brain dump of like, do this and do this and do this and do this and do this, or try this and this and this and this and this. And it's detailed, but also so big picture that it's sort of overwhelming and hard to operationalize, hard to actually like figure out what to do. So that's one of the spaces that we're trying to like fill that gap in between the listicle, which has the big picture information, and the actual like, no, do try this, or like pick one of these. Yes, and we need caregivers who can provide respite. Absolutely. That's a huge gap. Yep. Okay. All right, so we are going to wrap up. Thank you, Ashley. I would love to hear more from you. If this resonates, if you think it's a good idea, if you think it's a bad idea, just give me all of that. And I will keep following up with Bryn and with you all to let you know what comes of this. Because again, we're just in the brainstorming phase. We're thinking about this is possible, and collecting information. And I want to thank you all for your time. I'm going to put my email address in the chat. You're welcome to reach out to me if you have questions about extension, or if you have more thoughts about this, or if you just want to chat. So thanks, everyone. And thank you, Bryn. Appreciate it.
Thank you. That is such a wonderful endeavor to even broach the topic, because it's vital. And it's a hard one to wrap your head around. There's so much information. So thank you for coming to share with us, and to be willing to hear from the experts themselves is what they think will be helpful. I am copying and pasting, Tanya, your information about what Portage County offers. Which was excellent. I was not able to attend at the Alzheimer's Association conference, but I believe Carly spoke about that panel. And Terry, your information about having almost, I wish I would have known then what I know now kind of experience with family caregivers sharing. So I'll be sure to capture some of that and send it Kristen's way. And please be sure, she threw her email in the chat to, as you percolate and as things kind of settle, and, you're like, wow, this would be a really good thing, or I think Kristen needs to know about this. Please let her know. So we have about a half an hour left, a little bit less, and I will, Angie, I'm not sure, did you want me to share your slides, or did you want to share? Either or I'm prepared for.
I can go ahead and share. That's
okay,
fine.
Go for it. The floor is yours.
Great. And Bryn, if you want to keep me on track with time, that would be great. I'm just moving over everything on my screen. Okay, thank you all for having me today. There is, I recognize quite a few names, so there's overlap, obviously, with health promotion and caregiver coordinators. We often see people doing dual roles with caregiving and health promotion. So my name's Angie Sullivan. If I haven't met you, I've been with GWAR about 6 years, and my specialty area as a consultant is evidence-based health promotion efforts, so 3D in particular. So hopefully I'll give you a quick overview on the types of things that we work on within the health promotion world and Older Americans Act, and then also some areas that I see overlap, in particular with some funding sources. And feel free to throw questions in the chat. And it was really timely that Kristen was on. We see a lot of our health promotion coordinators or the person designated to work on health promotion in every county working with their local extension. It's been a really great partnership over the last several years. The purpose of Title III-D or health promotion is really to reduce the need for more costly medical interventions. A lot of teaching how to manage, self-manage chronic conditions, and there's a whole host of health promotion programs, which I will talk about a little further down the line here. So 3D was integrated into the Older Americans Act in 1987. And again, that's to support healthy lifestyles, so prevention for those 60 and older. Priority, as it goes along with the Older Americans Act, is given to serving older adults living in medically underserved areas of the state or those who are of greatest economic need. One of the most notable things with evidence-based health promotion happened with the reauthorization of the Older Americans Act in 2016, which said health promotion programs must be high-level evidence-based to use your Title III-D funding. Prior to 2016, it was really whatever the aging unit deemed what they thought health promotion was, which a lot of times turned into things that really weren't intentional to that goal of reducing the need for more costly medical interventions in managing chronic conditions. So this was a way, and I'll talk more about what it means to be evidence-based, because you'll hear that term used quite a bit in different capacities. But when we look at the 2022 appropriations for the Older Americans Act, you can see I had to put a big red arrow because Title III-D or health promotion is 1.1% of the overall appropriations. So it might seem like a tiny slice, but it's a really important slice, because if you don't have your health, it's really hard to manage anything that comes your way, especially if you're a caregiver. So providing health promotion programs to caregivers is really essential to the overall success and health of the caregiver and the recipient. So I have seen a lot being able to be done with 1.2% of appropriations, and I'm always here to talk one-on-one with your county to talk about what are your health needs, what are your resources, who are some people we can partner with, and really come up with a plan. So if you, at the end of the year, if you're a part of these conversations and somebody says, oh, we only have $1,000 in evidence-based health promotion, there's not much we could do. Stop right there, give me a call. There's a lot we can do, and happy to talk through it and brainstorm. So what does it mean to be evidence-based? It's really just saying there's research behind the program, there's measurable outcomes. The program, if I took an evidence-based program in Rock County, where my home office is, or I took one in Bayfield, should be very similar. Obviously, there's going to be some differences because of the personality of the educator, but it should be really fidelity across. So it should be the same program. Also, there's a protocol for training and technical assistance. So there's somebody that provides leader training. If you have questions about the program, there's somebody to refer to give you guidance. And then there's also data monitoring and tracking. So entering that data into your WellSky or SAMS. And if you're taking programs through another agency like the Wisconsin Institute for Healthy Aging, they may have some additional paperwork. There's a lot of advantages to providing high-level evidence-based programming. It takes about 4 years from start to finish for a program to become high-level evidence-based. So that's a lot of time, effort, and resources. We see most of our high-level evidence-based health promotion programs coming out of universities. So we are really lucky in Wisconsin to have the Wisconsin Institute for Healthy Aging, where they have a research arm, and then we're able to put the program into practice, which is an important component as well. So we know that evidence-based health promotion programs have a positive impact on the participants. It's proven through research. So as a master trainer and a leader for Stepping On for years, it was really powerful for me to go in front of the group of folks that first day and say, if you come to all 7 sessions and participate and do the homework, you're going to be 31% less likely to fall in your home. So having that evidence to really prove that the program, if they put the effort in, will have a positive outcome was really powerful. Also funding, I mentioned partnerships. If you can show that a program has positive health outcomes, health systems, clinics, any partner in their community is going to be more interested in that program. Also, you can use your limited resources and concentrate your efforts on delivering the program. So you're not having to create curriculum or content that's already done for you. A lot of times they're, depending on the health promotion program, they can be pretty scripted as well. So it's really, you know, the training, you should just be able to go ahead and implement that. And older adults are savvy and wise, and they want to invest their time and efforts into programs that they have been proven to be successful and worth their time. So there's 5 criteria set up by the Administration for Community Living for a program to become high-level evidence-based. As you can see, they're pretty extensive. I won't go into all of those because I want to make sure that Nick has time as well. But one, it has to be demonstrated through evaluation for improving health outcomes in older adults. So the research has to be done on older adults. There's also a control group, which is where cost comes into creating these programs. And then it also has to be published in a peer-reviewed journal, implemented in a community site. And a lot of times our aging units and ADRCs are able to be a part of that pilot through the Wisconsin Institute for Healthy Aging. And then it also must include leader manuals, any participant materials. I look at the list every year and make sure that, you know, if you go out to a website, that it's still, especially after COVID, lost resources, there may be no opportunity to be trained, then that would come off the high-level evidence-based list. So you can see those 5 criteria are pretty extensive. And we do see overlap with caregiving programs. There are several high-level evidence-based caregiver programs which are listed on the National Council on Aging's site, and I have provided a link in here for you to view those. Probably the most powerful, or the most powerful, the most popular and powerful is Powerful Tools for Caregivers. So that simply means you can use your Title III funds to implement powerful tools for caregivers or your caregiver funds. Typically, there's more caregiving funds, and that's where we see it implemented through. But in case you know you have some 3D dollars left over that you might want to implement, you could certainly do that. AMP for caregivers, and Kristen mentioned AMP earlier. Several extension educators throughout the state are trained in AMP for caregivers, which is a 12-week program. Again, you can use your 3D as well as caregiver dollars. If a program is not high-level evidence-based, you could also use your Title III dollars, supportive services, which are more, there's more flexibility. Other programs that are listed on the National Council on Aging's site for high-level evidence-based program would be Stress Busting Program for Family Caregivers, Reach and Reach, TX, and then T-Care Support System, so Tailored Caregiver Assessment and Referral. And I will show you where you can get more information and go out directly to those programs and learn more about them to see if they would be a fit. I also have heard of, and you may have heard of Savvy Caregiver. That's not on the National Council on Aging's list for high-level evidence-based. However, you could use Title III non-evidence-based for Savvy Caregiver. So how much, am I good on time? Am I able to go out and kind of show this site?
Yeah, I think you got about 60 seconds or so, so it's okay.
Perfect. Great. Okay, we'll see if this works here. I just wanted to, and I'll share this PowerPoint with Bryn, so you're able to go right out and see this. This is a listing of all the high-level evidence-based programs on NCOA's list. If you download the spreadsheet, you can also Google, but I thought this was really helpful if people want to see it all in one spot.
Can you scroll down a bit just so we can see? Oh, there it is. Holy cow.
Yeah, it's coming. Yeah, so you can see there's a lot of programs, but you can just kind of look at the, I'll go down to powerful tools. Sorry if I'm making you dizzy. So you can see here, powerful tools is listed. It has the link. It also is able to break it down if it's in person, group, how many sessions it is, if it can be done virtually or by telephone. So I encourage you to all go out and kind of take a look and see what caregiving programs are available. Again, anything on this list is considered high-level evidence-based, so you could use health promotion dollars as well as 3B if you have additional money in the supportive services area. So I just kind of wanted to show you how it's broken down, but you will have access to, and I'll put the link actually in the chat as well. So I think that's my 60 seconds, right, Bryn?
That was a whirlwind. I'm so sorry. We had
No,
so
hopefully it
many
made sense to folks. It was a lot of
the
information.
stress busting one actually sounded amazing too. I know so many caregivers are not only working, whether it's full or part-time, but they may also be a sandwich generation caring for little kiddos as well as older parents or in-laws or just older extended family members. So I feel like there's a lot to offer there. So thank you so much for your time. And without losing any more time, Nick, would you round us out for the meeting and share about your role in transportation and how it can support family caregivers?
Sure. Thank you for having me. My name is Nick Musson, and I am the transportation specialist with GWAR. Can everybody see my presentation?
Yep.
Perfect, perfect. So my goal today is just to give you a high-level kind of overview of the transportation system out there. And just so you're aware of what all the resources are and give you some tools to be able to access those resources and take advantage of the transportation options available. So the very first thing, why is transportation crucial? Why is transportation important to all of us? Why is it important to live a quality of life? Well, transportation provides access to essential services. It empowers individuals with the ability to move freely and independently. And that is so important when you're trying to live a connected and a quality life. Enables people to maintain social connections and build relationships. Allows them to connect to job opportunities and enable them to earn a living. Provides access to healthcare services, is a tool to help reduce isolation and loneliness, allows them to connect to the greater community, allows them to connect to others out there. And I really look at it as the backbone network that supports all that we do. And I know that sounds a little bit crazy, but transportation really is that network, that backbone network that allows us to connect to all the different services, connections, people, social engagements to live a quality and healthy life. So how is our transportation system funded? And I put links in all of these so that you can get this PowerPoint afterwards. And if you're interested in diving into any of these in greater detail, you can click on them and it'll take you to a webpage that's going to explain all about these programs, because there is a lot of different programs that are operating out there to fund our transportation system. So when it comes to the Federal Transit Administration, we have a number of programs that come to the state to fund transportation. So we have Section 5310, Enhanced Mobility of Seniors and Individuals with Disabilities. This program is a fantastic program. It goes to help fund programs like mobility management, and mobility management are individuals out there that help individuals navigate the transportation, help them connect to their different options available out there, help them make sense out of it, help them get from point A to point B. They also, along with mobility management, this program helps support operations. So this could be a volunteer driver program. It also helps them purchase vehicles to help support their program. And then we have Section 5307. This is the Urbanized Area Formula Funding Program. So this is Federal Transit Administration funding that comes in to fund the larger urban area transit systems. So when you look at this, we're talking about transit fixed route systems that are in the Appleton, the Green Bay, the Milwaukee, the Madison area. So it helps fund those fixed route transit systems. It also helps fund some of the smaller urban transit systems, and some good examples of that would be maybe a Fond du Lac or an Oshkosh. So it helps support those transit systems to be able to provide fixed route transit. So those buses out there providing transportation for those that need to get from one point to another. And then we have Section 5311 formula grants for rural areas. So this is kind of that equivalent to the 5307. So instead of the urban areas, it's more focused on the rural areas. And you might ask, well, what kind of projects are funded under 5311? Well, you're going to see things like shared ride taxis. So like, for example, in Wapaka, the city of Wapaka, they apply for 5311 funding to be able to provide shared ride taxi services to individuals in those rural areas. Or like the city of Shawano has a shared ride taxi service. So the 5311 funding is federal funding that comes in to provide transportation services in the rural areas. Next on the list is another federal program, Administration for Community Living. And I put this on here because not everybody's aware of, but Older American Act Title 3B supportive service funding can be used for transportation. It's not very common, but it can be used to help support transportation for aging units out there. We have I would say about 5 different aging units across the state are taking advantage of this funding service. And then next on the list is the state funds that come in. And first on the list is the 8520 State Urban Mass Transit Operating Systems. So this funding that comes in gets folded in to the 5307 funding to help provide the fixed route transit services across the state. The 85.205, now this is paratransit aids. This funding comes in to help support paratransit services that are centered around the fixed route transit services out there. So right now there's the ADA requirement that if there's a fixed route transit service, they need to provide a complimentary paratransit service within 3/4 of a mile of a fixed route service. So this 85.205 paratransit aids comes in to help support paratransit services. Now this would be to help individuals with that maybe are in a wheelchair or that need some extra accommodations to when it comes to transportation to get to where they need to go. So that is tied to the urban kind of fixed route services. Also, I should note that some of that does go to some of those rural areas to be able to help support paratransit services in that area as well. But mostly in when it comes to rural transportation, you see 8521. Now, this is County Elderly and Disabled Transportation Assistance. This is transportation that comes from the state, goes directly to the county, and provides transportation for older adults and individuals with disabilities. This program is based on population. So it is based on the number of older adults and the number of disabled individuals you have within the county. And then it's split up by formula across the entire state to each county. And the county has the flexibility to decide how they want to spend those funding as long as they're serving seniors and individuals with disabilities. The next program is 85215. In this particular program, is focused on tribal transportation for elders. So this is funding that goes directly to the tribes to help support transportation for their elders. It's kind of that equivalent to the 8521, the transportation funding that comes into the county itself. And then 8522, Specialized Transportation Program. I love this program a lot. This gets folded up into the 5310 program. And if you remember, that is the enhanced transportation for older adults and individuals with disabilities. But what that funds, again, is mobility management. So that person, that one-stop shop, that individual that can help people find transportation, can navigate the transportation system, can figure out what the client is qualified for, it goes to support that program. It also goes to support capital, so purchasing of a vehicle and operations. So I know that's a lot. And when it comes to transportation, they are so fixated on numbers, as you can tell.
Why do we have
So
to know this?
why?
You can be smart.
Why would you want to know this? Well, if you need transportation for maybe someone that you're caring for, you could access these services to get transportation. Transportation connects everybody to the community, like that first slide I showed you. It's all about social engagement.
Oh,
It's
yeah.
connecting to medical services.
Hey, I get it.
Okay. So my goal here is just to show you that there are options within each, where everybody lives. There's options out there, and you might need to take advantage of those options. So I want to provide you with as many links as I can to get you connected to the transportation services out there. Okay, so next on the list is, this is a table. This goes through all of the different funding sources, and you can see that, I'm not going to go through all of this, but you can see the geographic area, you can see the eligible recipients, you can see eligible projects, you can see clients, who they serve, and then you can see what type of grant. So that's just more of an informational thing. I'll leave that to you if you want to dive into that in some greater detail. And then I have a map here. This is really important. This kind of lays out the entire transportation system for the most part across the entire state. So you have countywide transportations, multi-county transportations, fixed route system. You have the shared ride taxi, tribal public transportation. You have it all kind of laid out on a nice map. And up here is a link if you wanted to get access to that map. So if you wanted to blow that map up into your area, you then could access that transportation services. And then I did want to touch on volunteers, because volunteer driver programs in Wisconsin are so important. They support all of the different aging programs across the state. They help individuals get to medical appointments. They help deliver meals. It's just a very important part. Volunteers are just huge, and volunteer drivers in particular. And they could be part of any kind of senior transportation program, disability program, and they really operate a lot in rural areas. So volunteer drivers connect you to your greater community, but also do home delivered meals. They provide nutrition to those people that cannot leave their homes. So I just wanted to call that out because I feel the volunteer driver programs play such an important role in helping to address transportation challenges faced by vulnerable populations out there. And then I want to just talk a little bit about what I can do for you. If you're interested in transportation, and say you're working with a client that maybe you want to get out and get some kind of social engagement, connect to the greater community, and you're just struggling to find options, I can sit down with you. I can go through all the different transportation options in your particular area. And in most cases, I might be able to help you set some transportation up. But what I provide for aging units out there, I provide any kind of technical assistance they need. I provide education. So I do things just like this, some transportation 101 for different partners out there. And I will go around the state and I provide presentations. I did a presentation at the Self-Determination Conference, but I'm also an advocate. I help advocate for the transportation system out there, the individuals that want to use that system. I'm working right now to pass legislation to help protect volunteer drivers out there so they're not getting their insurance premiums raised or denied because they're getting lumped into these other services, these transportation network services like an Uber or Lyft. I help people support grants. I write letters of support. I do data analysis, reporting and applications. And then I just help with state and federal legislation. I keep you up to date, and I'm connected throughout the state. I work with regional planning commissions, metropolitan planning organizations, Wisconsin Department of Transportation, Federal Highway, Federal Transit Administration. I work very closely with the state organization that's centered around mobility management. And then obviously I work very closely with the transit systems across the state. And I know I know I didn't have a ton of time to dive into these in greater detail, but my goal here was just to show you what resources are out there, and then also to offer my services to you to help you if you ever need any help trying to find some transportation services. So thank you so much.
Thank you so much. See that there was a question regarding the volunteer transportation providers, and Nick is definitely hard at work and very much a subject matter expert as far as what supports are offered to volunteer drivers. So please feel free if you have particular situations to reach out to him directly. I can also share that one of my big takeaways was the Administration for Community Living, or that the OAA 3B supportive services dollars can be used to fund rides. So hopefully if you're coming up short and you need respite for a family caregiver or for their recipient, these provide you just some basic options about how you can best support them. So that was a whirlwind meeting. I will go ahead and make sure that within no more than a week from today, they are posted with the notes, the presentations. Thank you all. Thank you, Nick. Thank you, Angie. Thank you, Kristen. Thank you, Lynn. Everybody who participated in the chat and in the Slido feedback that Kristen offered. I really appreciate it. Your time is valued. And with that, I hope you have a wonderful rest of your week. Thank you.